So we're going to enforce it by way of the Shelby County Sheriff, as I told you before. Generally, we have to go to court ultimately to enforce if we find non-compliant business. We currently believe that is not the case anymore, that we will be able to comply, that we will be able to enforce it without even going to court per the latest changes to the regs and state law by the governor per his last executive order. So we believe, do you want to comment on that? That now we don't have to go to court? So we don't currently believe you have to go to court anymore because of some changes that the state made. So in the first instance, we'll politely ask people to be compliant, but we might, we do have a stronger set of options should the need arise.
Mayor, what would mean non-compliance? Is it someone driving because they couldn't go to the grocery store or whatever? So how do you know?
So we think that it'll be relatively straightforward for people to comply. If you take a look at the orders, it talks about non-essential services, but it still allows people the discretion to travel to the grocery store, still allows people the discretion to go to a lot of different kinds of jobs, to commute to work. So there should be, the point is to get the message out. And so we have found through all our various discussions that the only way to get the message out around social distance and around reducing spread is to be extremely aggressive. And so that is certainly the perspective of Mayor Strickland. I think that's what prompted his action today. And so that's the most important part of this, is to get the message out, and hopefully people will on their own comply.
When you talk about spread, have we been able to ascertain whether there's been more testing done in Memphis? Because spread, of course, if you base it just on the number of people who test positive is one number, but as a percentage of people tested, that would be a different equation.
Very good. And identify yourself, and then Director Household will answer.
Lonnie Ramos, Daily Memphis.
Very good.
One, we don't have exact numbers on the number of people tested. We do have the cases, which are the individual counts. We do know that the testing has gone up significantly, but testing for COVID is very targeted. It's not like you just do mass testing of individuals. You test people who have signs and symptoms or who have been in contact and have signs and symptoms. Right now, the data that we looked at most recently, and again, it's incomplete as far as number of tests, was around a 3% positivity rate. So that's one way we look at it. But the other is that for every case that's reported to us, we do a very intensive contact investigation to determine where they traveled, who they've been in contact with, what type of work they do, and so on. And what we can tell you through the contact investigations is we have ongoing transmission in our community. Our initial cases were related to travel, people who went elsewhere and brought it back. Those people have now spread it to other people, and those people have spread it to other people. So it's really time to take aggressive action to stop that ongoing it's called generational transmission, to stop that transmission.
When you say you have 4 people who are not from Shelby County, did they just come here for medical care? Is that how they ended up here?
They came here for different reasons. If you recall, probably last week I mentioned we had someone who traveled from another country and had been traveling through the U.S. on an extensive tour. That person was diagnosed, and then their closest contact was also diagnosed, so that's 2 of the 4. And then others are people who may have traveled here to visit family and became ill and then got diagnosed when they're here.
Dr. Householder, I think either Friday or Saturday you indicated that the private labs were being encouraged to disclose the numbers that they have tested even if they're negative. Has that happened yet?
So they're reporting that to the state, but as I said, those are not exact numbers yet, and so they're not as reliable as we would like them to be, but that's where we got the positivity rate that I mentioned earlier. I sat with one particular provider and looked at the numbers from their healthcare system, and then the state is going to try to calculate that at the state level, but honestly, there's some transition at the state. They used to use a different database, but now they're moving to a new database, and all of those labs are being put into that database. So I would say it's going to be a week or 2 before we're very comfortable with all the data.
Where are those people being treated now, those who tested positive?
How or where?
Where and how?
The majority of people are at home. We do have people who have been hospitalized. We, again, have not had deaths, which is a positive sign for us locally, but the majority of people have been able to be treated.
How many are in the hospital now?
I don't know the exact number currently.
Doctor, can you talk about the data from the Tennessee Department of Health that talks about demographics, that some of the highest numbers of people testing positive are ages 21 30.
Yes.
Do you believe that they are not taking this seriously?
I think that different individuals are taking it seriously in different ways. We have really tried to reach out to the younger crowd to reinforce that they're just as at risk of becoming infected with COVID. They're less likely to be as ill as others. But if they take appropriate action, they'll prevent the spread to others. So I do think there are some who are taking it very seriously and some that are not taking it as seriously as others. And we're currently here not reporting the age groups, but we hope to be able to do that by the end of the week.
What does it say when the ages 21 to 30 are the highest number?
That there's, the social connections are a critical component of transmission. One, travel is part of that, but also social connections, and so the need to reduce those social connections through social distancing is a critical piece to reducing transmission.
Dr. Householder, do you get a sense of when we're going to maybe hit the peak? Because obviously more cases, like you said last week, as more are tested, obviously the numbers are going to keep going up. Do we have a sense of when this might max out and hopefully start going down?
So if we look at other countries, particularly China, because they have obviously had the longest duration of time working on this particular epidemic, is that we anticipate that it may be as many as 4 incubation periods, which is almost 2 months. You would ideally hope to see some peak in 2 to 4 weeks, but we know the numbers are going to continue to go up for the next couple weeks and hopefully start to plateau by then and then come down. We don't know in the United States, and particularly here in the South, where the summer-spring seasonality is going to impact it. China, their outbreak occurred in winter, and so we don't know what's going to happen as the warm weather comes in, if that might have some significant impact as well.
And do we have a sense of when, with this business, non-essential workers really clamping down, what hopefully impact that will have in percentages of cases not avoiding the spread further?
So, a lot of people have asked, is this really going to work or not work? And you can look to other countries, particularly China and also to some degree now Italy and Spain, is that by enacting policy to promote social distancing, it does have an impact. And so we anticipate that it will have a positive impact.
What's the percentage that would show that it is working? And Mayor, follow up to you. Are you willing and are you ready to extend through the next, as the doctor said, 4 incubation periods with this new order?
So I'll go first, and it's not necessarily a percentage. We do look at what we would call the prediction of the epicurve, and generally across the world, the cases double every 5 to 7 days. So we would be looking to reduce that doubling every week and to lower the peak of the epicurve and to hopefully spread it out somewhat. So we actually will be looking at our data overlapped based on what we would predict would have happened if we did nothing whatsoever.
Isn't that based on testing, on the number of tests that are conducted?
Well, it's based on the number of people who are reported positive, and that's based on the people who are symptomatic.
Regardless of the number of people that are tested or
Correct.
symptomatic?
Correct.
This-
I'll turn it over to the mayor to answer that question.
Sorry.
I think just like Director Householder said, we're all working really hard here, and I think we're committed to doing what we can to try to mitigate the number of cases. I think even at this juncture, this has moved extremely rapidly, and everyone by now knows someone who has been quarantined, someone who has been negatively affected because they have been isolated or because they've gotten sick or because they've lost their job. And the only way we're going to get out of this moment is if we don't panic and if we all work collectively in order to reduce spread. And sometimes it's going to require all of us to take some real tough, disruptive actions. And so I think, yes, we're committed to going along this course in order to prevent spread. I should also say Commissioner Jones is here on behalf of the County Commission. Do you want to say a word or two since you're present?
No, yeah.
Okay, very good. Thank you.
Doctor, will there be conflicting numbers if you're ramping up testing? When will you be able to tell whether or not the shelter-in-order place has had an impact? Because as you increase testing, the numbers will go up. So
So
how
here's
do
what,
you gauge that?
that's actually a great question, and people continue to ask it. So I will reiterate what I've been saying for weeks now. We have not had difficulty getting people tested in Shelby County from the very beginning. A lot of those tests were run at the state, So the real question is access to testing, not just mass testing. Mass testing, you end up testing a lot of negative people who did not need to be tested, and you lower your positivity rate, which lets me know we're wasting supplies. What we look to is whether or not people who have signs and symptoms were able to get tested, and when they were tested, was that positive or not. So I'm confident in the numbers that we currently have, because we did not have difficulty getting tests approved previously.
You said the incubation period is 2 weeks. Obviously, it's been 2 weeks since those first people were diagnosed. Does the health department have to clear them to go back to their normal activities, and has that happened yet?
So there's been some changes specifically for individuals who were diagnosed. So let's talk about the contacts first. Those are individuals who are quarantined because they were in contact with the case and they've not become ill. They have to be quarantined for 14 days, and we clear them at the end of that 14 days. And we can do that different ways. One, if someone needs a letter to return to work, we write that letter. If we know that they don't have any signs and symptoms, they're free to go back to their regular activities. For individuals that have been diagnosed, the current CDC guidelines are that generally within a week they can return to their normal activities, as long as they've been fever-free for at least 3 days. Now, I'll probably take one last question.
There's been a lot of discussion about hospitals running out of ventilators, similar equipment. Can you give us a status update for what's going on here in Shelby County?
So there's a system called the Health Resource Tracking System, and it's used statewide, where supplies are being tracked, including beds and ventilators, and there's not a shortage currently. But that's also one of the reasons we want to take aggressive action now. There's not a significant portion of our clients who have been hospitalized, so we want to make sure we reduce the likelihood of spread to people who are going to need to be in the hospital and need to access those precious resources. There is also a joint task force between the city and the county, and other municipalities participate. So every morning at 8 o'clock, we're actually looking at what resources there are, where there are gaps in resources, and how we can garner those resources. And that's everything from bed availability to ventilator availability to test kits and so on. So we have a system in place to be able to identify quickly if there's a shortage. And then also myself and Dr. Jane are looking at some predictions of what might be needed 2 or 3 weeks out.
Thank you.
And then Chairman Billingsley just joined us, so you want to say a few words? Okay.
Good afternoon. My name is Mark Billingsley. I'm chairman of the Shelby County Commission. I'm joined here by my great friend, Vice Chairman Eddie Jones. A lot of people have asked me in my own community, I live in Germantown, what can I do regarding this response? We do still have a lot of healthy people at home. They're bunkered down. My wife today is working on a puzzle. My kids are doing schoolwork. But a lot of people are at home happy and healthy, but they want to help in some way. So today I want to bring to your attention an effort. If you want to support those in the community affected by the coronavirus public health crisis, donate to the Mid-South COVID-19 Regional Response Fund. Your dollars granted to area nonprofits will go toward immediate relief, recovery, and resiliency efforts. Hosted by the Community Foundation of Greater Memphis Foundation, the COVID-19 Regional Response Fund will provide flexible funding to organizations serving community members who've been impacted by the novel coronavirus and the economic consequences of the pandemic in West Tennessee, Eastern Arkansas, and Northern Mississippi. Again, on behalf of the Shelby County Commission and myself being chairman, I would encourage you, those of you who are at home and to the media, to please spread the word of a response fund that is at the Community Foundation of Greater Memphis. You can give online. You can send a check to the Community Foundation of Greater Memphis. Already $150,000 in unrestricted operating grants have been made to MIFA, the Mid-South Food Bank, and Whole Child Strategies. The Community Foundation already administers grants in partnership with the City of Memphis, Shelby County Government, United Way of the Mid-South, and many other nonprofit partners. And I would encourage those of you who can make a gift to help those who are struggling with lots of issues today. Thank you.
You want to say any last words, Mayor?
No.
And I guess if I just had one question for, would you all support Governor Lee just making some sort of statewide initiative so it doesn't fall on mayors of municipalities across the state and we could just kind of one fell swoop order statewide as other states have done?
Yes.
Would you like to, would you want to expand on that?
I think, I mean, everybody has to go undertake their own process, and so I'm sure Governor Lee is undertaking a process, and he's listening to a lot of feedback because it's both important to take action and it's also important to get it right. And so I'm sure he's, trying as best he can to take action, but also get it right.
We're gonna go ahead and end. I appreciate everyone being here. This week we'll give updates Monday through Friday at 2 o'clock. We won't do the weekend unless there's something significant that happens, and if that's the case, Joan will send out a press release. Thank you.
Thank you.
Thanks a lot. See you.
Okay, everyone.
Actually,
Sorry.
Thank you. Hey, Rick.
Thank you. Parks are open, and outside activity is still encouraged. I think the recommendation of the orders are that even when you're doing outside activity, you stay 6 feet apart.
I know. I did that for you today. I told my wife I said I had to wear
It
something.
says parks are open, and it says outdoor activity is encouraged, although keep your social distance.
Mayor, can you talk to us about what is considered essential and not essential? Because we're on
If not,
Now, you know, I have a problem with us holding I have a problem with us